Are you pregnant, about to conceive, or of childbearing age? Then you need to know this important fact. Why on earth will a hospital know they aren't ready, yet they are admitting patients to waste 2 lives as a mother and child? Isn't that a death trap? I was reading an article the other time on the website of the Nigerian Health Watch, and it was about a man that the wife gave birth with injuries, and the hospital didn't have the common drug to control the bleeding. By the time the man returned from where he went to check for the drug, the wife had passed on. The worst part was that the man left the matter to go like that because he felt that even if he should take a legal action, it would still be both waste of time and resources. But he could have tried. So it shouldn't be a surprise why Nigeria is among the top 4 countries with the highest maternal deaths, estimated at 58,000 yearly and about 150 daily. These are women dying only from childbirth cases. Most people working in the hospitals have seen a number of people die that the thought of the next person dying doesn't move them at all. I will never forget in my first pregnancy back in 2016 how my husband warned me never to use any drug they will give me at antenatal until he has seen it and confirmed that it was okay. He's a manager in a pharmacy company, so I believed he knew what he was talking about. Then one Tuesday, I went for antenatal and they gave me warm anti-malaria medication. I quickly called my husband if I should go ahead and take it, since he wasn't going to return home early, but insisted I don't. Finally, he returned and looked at the drug and was like, this batch of the drug has already expired since 2014. This is now 2016 and the expiration date on the drug reads 2019. You can imagine. I didn't even believe until he brought it out from the pack, and it was clear that they had cut off the part they wrote the expiration date on the sachet. The next morning, he went to his office and got the current batch of the drug that hasn't expired and showed me. Then by Thursday that same week, he went with me to the hospital to confront them. And trust my husband, he first came in calmly as though he was making inquiry, but he was recording the moment. When everything was now obvious, they started begging, saying it was the guy that supplied them the drug that played that fast one on them. It's just that I begged him to forgo, otherwise the hospital would have faced being shut down. But what touched me most was a woman we met at the entrance of the hospital who was already leaving, and since she had the hospital bag, I approached her to see if they gave her that same expired drug, and right there was the same expired drug in her bag. I finished telling her why we came and she ignored us and left with the drug. I wonder what she was thinking. Except God had intervened, the life of that woman or her child or both would have been endangered. Likewise, many others who got the expired drug before we came to stop the hospital from giving it out. I had a first-hand experience of childbirth trauma during my first childbirth that lasted for almost a year after. It is only better imagined. The fact that I am a nurse and still face this was not funny at all. So what we are talking about doesn't respect certificates. I had a 3rd-degree episiotomy cut, and for months I was in pains. It was so painful urinating, let alone talking or making love with my husband. It was that bad. It was one of those days my husband saw me in pains that he started asking if this is what every woman had faced or would have to face. What was in my mind was finding relief myself, but my husband was looking beyond my pains to other women having to face the same issue. That is where the journey of creating this guy started. Research upon research revealed there was no cure to the challenge. That was how we started researching if there was any way to prevent the problem. The only thing we found people were doing at the time in a bid to preventing the problem was to engage in perineal massage. But unfortunately, many still get injuries at childbirth after doing perineal massage. So it was obvious that perineal massage wasn't just the solution. More was lacking. All that perineal massage tries to do is to help widen the pelvic so that the baby can have easy passage. But just that was never enough. So we went into research. After about a year and few months, we came up with a solution that has helped over 500 pregnant mothers to enjoy childbirth without such life marriage-threatening injuries. Look at some of the feedbacks. I cannot thank you enough. I am a first-time mom using this approach and I had no stitches. Had the shortest second stage possible. I can recommend this over and again. I think every woman should be using the same. Thank you so much. It's Angelita, blogger mom. Another one here is, it ended up being my best investment in the pregnancy. It helped me a lot to prepare mentally and physically. I had an extremely short second stage of labor that lasted for like 5 minutes. No injuries and I walked away on my own. Highly recommended. That's Mrs. Mia. Definitely the best investment during pregnancy. It helps physically but also mentally to prepare for a birth. I had a very positive experience and ended up with only 2 minor tears with absolutely undamaged perineum. The minor tears were just because I didn't control my baby weight, which was 4.4 kg at birth. There's another mom here, Manwa. Then we have other testimonies here. Amaka from Enugu. The points are well detailed and practicable. I recommend it for all women. Eno from Cross River. I wish I knew this earlier. Ignorance na bondage. I recommend you get this. Linda from Jos. Wow, I couldn't have figured this out on my own. Even made it realistic. I highly recommend this. Rejoice from Ondo. Amazing points, fantastically presented with practical steps, super easy, recommended. Aisha from Abuja. I feel confident now. I'm pretty sure what to do and how. I recommend it for all. Susan from Edo. Me that don't like reading, finished the 2 models in less than 2 hours. Both insightful and helpful. Recommended. Matilda from Lagos. What you don't know, you don't know. That's how I feel now. A good material to always recommend. If you were thinking that it was easy getting the first set of people to try out if this works, then I can tell you that it was far from that. Even when it was being offered for almost free. When we first launched the solution officially back in 2019, after I had my second baby, most people we reached out to didn't believe that it is possible for a woman to give birth without sustaining such serious injuries. But 2 questions we normally asked were, 1. If something is possible for one person, will it be possible for another? And the popular answer we'll get is, of course, yes. If the other person can be taught how and will commit to the same process under the same condition. Then the next question will be, are there women who have had childbirth naturally without issues? And they will always say yes. Yes, but just few. And I love this second answer more because my vision is for many, not just a few, to start enjoying the possibilities. Let's quickly look at more facts to the issue. 1. Whether your baby is 3.5 or 1.5 in Nigeria, you are not totally free from getting an episiotomy. 2. Whether it's your first time or 5th experience with childbirth, the possibility of getting vaginal injury still remains. Fact 3. Doing recommended pregnancy exercises alone will not exempt you from suffering vaginal injuries at childbirth. Fact 4. Choosing a highly rated hospital doesn't guarantee you will have it easy with childbirth if you don't master how to engage yourself in the areas we have carefully highlighted in this course. Fact 5. Bleeding is the highest cause of maternal death and tearing or episiotomy is a major cause of bleeding at childbirth. Fact 6. Healthcare providers seem to care less about what happens to you since they can blame it on anything and go unpunished. Fact 7. Though prevention is said to be better than cure, some complications that come with childbirth have no known medical cure. Thus, their prevention is the only right thing to do, or one should get ready to face the consequences. You are about to discover a 100% natural technique to practice from the comfort of your home. And being a combined approach makes it super effective than any other approach ever known. Are you ready for this? The lesson starts by enlightening you on adequate pregnancy diet to improve the health of your unborn child while keeping the weight in check, and how you can achieve this diet plan with your local meals. You will get to understand your body equation in relation with your partner to be better informed as to what is expected of your type. Then you will learn how to select the best healthcare provider and what to do next to secure their maximum support that you need. Next are the recommended tips and tricks and how to go about them and be able to measure progress to possibly tell for sure that you are on the right track. Finally, you will learn to combine the points above to meet the two most important requirements at the hospital for injury-free vaginal delivery to be possible. Testimonies from experts. Currently, almost 90% of my clients use these special techniques. It helps them to prepare for the pressure they will experience during birth. They are able to breathe the baby out real quick. Most of them combine the new approach with perineal massage, and the results are outstanding. The vast majority have no injuries. It doesn't matter if they are first moms or not. All of them praise the technique afterwards. I sincerely appreciate from Amazon.
The information contained here helps tremendously. As a pregnant mom, you will know how to engage your pelvic muscles correctly, among others. The pressure during labor is very specific and requires a right combination of muscle engagements and other techniques to be effective and safe. This is where the technique helps a lot. Women are ready, confident, and in control. My midwife.
Now, doing these 4 simple things will eliminate every chance of childbirth injuries. The possibility of an injury-free delivery lies more with you, not with your healthcare provider, even though they try their best. Let's get deeper. Truth is, childbirth is obviously never going to be easy. You simply have to get smarter to make it appear easy. The more skillful you get at it, the less stressful for you. Hope that makes sense. Now let me hint you on this one thing you must begin first with to enable you significantly eliminate the chances of having childbirth injuries. I want you to envisage a normal vaginal delivery of your baby at full term without complications. Please make that your focus. It is a possibility that some have enjoyed, and I do believe that any positive possibility that one of us experiences is a possibility all of us can enjoy. So you have to believe that normal vaginal delivery is possible and that you have your share of that. With this belief, it becomes easy for you to start exposing yourself to the how. I can even say that you believe in that possibility already, otherwise you wouldn't spend your precious time on this. Now, the how to achieving this possibility is captured in a few things I'll be sharing with you briefly. I am Mrs. Simma, a registered nurse midwife, and currently lecturing in one of the schools of nursing here in the Southeast. I got married back in 2016 and am a mother of 2, a boy 4 years old and a girl 2 years old.
I was once a first-time expectant mom, very excited to have gotten pregnant some months after our wedding, like any pregnant mom normally will feel as her EDD approaches. I was, as my first pregnancy, both wishing this couple would pass over and at the same time so scared of the painful obvious that I had no idea how to escape. I don't like pain or injury a bit, just as you. Like you probably did, I heard many frightening stories about pregnancy and childbirth, stories of loss, injuries and pains. Not knowing what else to do, I prayed and kept praying until delivery day. Even while in the labor room, I finally suffered the worst pain ever. The 3rd degree episiotomy cuts that left me in anguish for the next 6 months or so. I vowed I wasn't going to take in again. I felt God doesn't answer prayers.
Giving birth to my boy was a hell experience, as I was given several episiotomy cuts that took up to 6 months before I could feel myself again. Of course, I couldn't make love with my husband for that long. I even would have lost my boy that first time due to stress of protracted labor pushes. That experience was what led to this important discovery on birth without injuries, where I will be revealing 2 most important things you must do back home and other 2 to do at your next and last visit to the hospital. And you'll be so sure to push out your baby easily without cuts, tear or episiotomy. I actually had my second childbirth with no episiotomy cuts, even when my girl weighed more than my boy in that first pregnancy that almost left me with depression.
Unlike me in my first pregnancy, now I know what works. As my EDD kept approaching, I wasn't any scared of the painful obvious, as I now have idea how to handle things. I had my second baby without such vaginal tear or episiotomy, unlike at first. By reducing or eliminating childbirth injuries, I was able to reduce the time of labor by more than half. Reducing the time it takes to give birth meant my baby came out quicker and was not stressed out, which has led to many stillbirths or babies dying shortly after delivery or requiring more medical attention, as they could develop some extreme medical conditions that will increase the hospital bill. By not allowing my baby develop some of those extreme medical conditions, I saved myself from running in and out of hospital weeks, months, years after birth. Some of those medical conditions could be physical deformity that could make the child become an object of pity to the society, as the child could still be dependent while he or she should have started taking responsibility. Thus, avoiding childbirth injuries helped me give birth to a baby I'm proud of as my own, and that will grow up with the right sense of confidence. Again, reducing time of delivery helped me avoid the protracted pain of labor that leaves many moms stressed out and even to pass out in some cases. Reducing vaginal injuries also saw that I was not in pain weeks, months, or even years after putting to bed. Problem of anal or bowel incontinence and the discomfort and shame of wearing adult pampers, which is very expensive, was also eliminated by preventing my vagina from tearing apart or from episiotomy cuts. It is also without dispute that one of the reasons my husband got married to me is to enjoy fun with me. This same is true for me, but both of us would not have continued enjoying this beautiful part of our marriage if I was negligent to have avoided the injuries on my side. This has been a major cause of infidelity in most relationships. By preventing childbirth injuries, I also helped to protect my marriage the much I could.
You see, nothing is really a problem to be concerned about if it does not pose threats to lives and the things we value. Avoiding vaginal injuries at childbirth will exempt you from some of the complications a woman is most likely to face if she should suffer such injuries at childbirth, whether it's vaginal tear or episiotomy.